Thank you, Dr. Ye and Dr. Tsai, for talking about the telehealth and also compare the differences between the telehealth development or usage in China and the US. And I didn't know the difference before, so it's great to know. Okay, so
Yeah,
there.
may I have a comment and a question?
Yes, please.
Yeah, I saw Winnie's slide. I think it's a very important slide about the four waves of impact and the footprint of COVID-19. I think there could be another fifth wave, which is ignored. It's about social determinants of health. So given this pandemic hurt the economy, so there won't be a V-curve recovery. This may take a longer, even the air curve. So the unemployment, and now I think recently the Congress are debating about whether the 600 US dollars insurance benefits are still being put into the new package to send to individual families, because people don't want to go back to work for some occupations because they earn more than they did before the pandemic. I think those are the and higher and unprecedented unemployment rate. I think those will have a ripple effect or reinforcing the COVID impact after this pandemic. It may take a much longer time than the impact of delaying care, all kinds of things, or the PTSD type of mental illness related cost. It could be like having this ripple effect. So that's my comment. So the question to Winnie is, through this pandemic, we know that for all systems, especially like U.S., China, we see the weakening health, public health system. And today, the CDC director mentioned that they have been like weakened, and the investment should be starting from today. But we know the public health is having a unique feature. When the public health is doing good, then it's not quite visible about the achievements. Unlike medicine, so when we have breakthrough, the cost of healthcare is increasing and the people lives saved. It's not as visible for the public health. So after this pandemic, your thought about how to strengthen the public health. We know this is a weakened and much weakened compared to the other two angles. We usually see basic medicine and clinical medicine. So if the public health side is weakened, this triangle won't be balanced. And to Li Ning, also your thoughts about whether the federal government may have any plan to increase reimbursement, changing the incentives to better tackle this public health crisis, because we know the scale, the depth of this issue is so unprecedented. But our measure currently is so low. The CARE Act only give like less than 8% to public health measures like contact tracing, testing. But the reduction, the contraction of the GDP is much higher than that. So would we have more spending towards those public health initiatives? Thank you very much.
I'll leave the US question to Dr. Tsai. I think that this outbreak actually in China at least has elevated the importance of public health significantly. So, I mean, if you look at all the School of Public Health now, definitely is getting a lot more attention. I understand many schools of public health are getting more slots for hiring, more slots for students. But my point is this: money may be one of the cause of poor public health, but money doesn't solve the problem. I think that in the case of China, it requires a system level change so that public health is actually also integrated with medical decisions in a way that is coherent rather than as two separate decisions. And resources need to be more coordinated. And if you ask me, China's current effort of trying to develop integrated delivery is a good way to go. But what we have seen, a lot of the integrated delivery system is actually hospital-led. Now, that's unavoidable because primary healthcare is very weak. So, but there are innovative ways for you to make the hospital held accountable for improving public health, I think that has to be something to be seriously considered. Otherwise, resources will still continue to be sucked into the hospitals, as I show the 6 huge hospitals that will be built in Wuhan already.
I'm going to chime in on this. So I think what's unique about public health is that it's so rare. Like a public health event is so rare. It's not like chronic disease or regular medical disease. We see it every day. So we can, like, even we have the best intention to build a new system, like we can see when the medical spending reduced tomorrow, like we can see it right away. But for public health, it's such a rare event. Let's say even every country has the best intention. What would be the mechanism to know we are doing the right thing? So I'm going to throw the question to all the presenters.
I think you're talking about emergency rather than general public health, right? Public health should be a regular, everyday thing.
Yes, thank you for clarifying.
Right. And yes, you're absolutely right that after a while, I mean, right, SARS, when China have SARS, all the attention is on it. And 17 years later, and I'm sure, I mean, it's just human being. We thought that is so far away from us. And I would let Dr. Tsai talk about the US situation. I mean, Obama has actually set up a separate fund, a separate unit that you can trigger that to happen. So earlier on, Chen Xi mentioned about Taiwan. Taiwan has an interesting system, which I think that many countries can think about. It's almost like an alarm system. So the alarm system would get triggered off to be 3rd level importance. And of course, that would have to depend on, they have to have the information and the data coming in. But that's sort of like a very moderate level. And they would have the CDC director making certain decisions, have certain authority to do further data collection and whatever. And then they have a very clear guidance on when it would have elevated to the next level. Then it is actually the Minister of Health who would also have the Minister of Finance and also Labor and the equivalent of them sitting at the same board that would make other level of decision. In other words, you have to build a system. It cannot be dependent on you strike the alarm and then it's 1 or 2 individuals making that decision.